Hey everybody, it's Joel here at Vintage Fitness down here in the basement studio. Wanted to get out a little information to you about taking care of your hip joint. I've got several other hip rehab videos on my YouTube channel, but this one, I wanted to throw one out at you to try to help prevent the need for a hip replacement. This is a simple thing you can do. We're going to string together a bunch of exercises to help rehabilitate that hip and maintain range of motion. Remember, the hip is a ball and socket joint. It's supposed to be able to pivot and rotate nicely. In the modern world, a lot of our activities force us into turning that hip basically into just a simple hinge joint, meaning just flexion and extension, much like your knee, which is primarily a hinge joint. The problem is, the hip was built to do all kinds of movement, all 360 degrees of range of motion. So with the modern world, a lot of sitting, a lot of desk work, a lot of computer work, driving, whatnot, we don't get a lot of activities to help us work the full range of motion of the hip. And what happens is the cartilage starts to wear down, thin out, and eventually you end up with the ball and the socket approximating each other, bone on bone. And once you're into that position, you're looking at a hip replacement, right? This is very hard to salvage. What we want to try to do is catch your hip before you get to this. So if you've ever been to a doctor and had x-rays or an MRI and they've told you, your hip is wearing down, call me in 5 years, we'll just replace it. Baloney on that. Let's see if we can save it and not have to go in and have it replaced. Yeah, if you don't change your habits, it will just continue to wear, and in 5 to 10 years, you probably will need to replace it. But if you want to avoid it, here's a way you can start working on it. And remember, you're a work in progress. It's not going to happen overnight. This is stuff you'll have to do, well, forever. But you know what? So what? It's a small price to pay to keep yourself out of the surgeon's office, okay? So, I'm going to show you just a few little things here. We're going to start standing. We're going to move to the ground. My suggestion is string these things together, make it a quick 10-15 minute workout tops. Don't overdo, because what you really want to do is get lots of repetition in. So what you should be doing is doing this routine 3 or 4 times a week. What I personally do is add a lot of these movement patterns into my warm-up routine before I do my kettlebell training or my cardiovascular training or my fitness training or whatever I'm doing that day. I'll spend 10 minutes warming up, and I throw a lot of these movements into the party so that I get some good hip rehab in there just naturally, okay? So do it regularly, 3 or 4 times a week. 10, 15 minutes max, move on, do whatever's next. So let's start with just some simple things we can do standing. The first thing we're gonna do is just some simple hip circles, okay? So just like, think about using a hula hoop, right? It's kind of like doing a hula hoop. I like to stick to reps of 10. I keep it simple, short, sweet, move on to the next exercise. So here we go. Hip circles, we'll go to the right here first. So we'll just go 1, there's 2, 3, 4, 5, 6, 7, 8, 9, 10. Stop. Now we'll reverse it. Do 10 the other way. And you go as, whatever pace works for you, whatever range of motion you can work with. Remember, if you've already got hip pain and you've got hip symptoms, I've already lost count. Let's say that's 10 there. If you've already got hip pain, hip symptoms, your range of motion may be altered already. So work within the range of motion you can and be patient. You're building, right? It takes time. Keep at it, stay regular. It may take weeks, months, years. You may never get normal range of motion back depending on how much hip wear you have. But the idea is, let's get back as much as we can and maybe prevent you from getting worse and thus needing to have that hip replaced. Especially if you're younger, right? You don't want to have that hip replaced if you're, 40 years old. They do have an expiration date. So we're trying to get more life out of your hips. So hip circle is what we start with. Next thing is a crescent step. And we're going to do 10 alternating, so 10 total. And crescent steps, remember, we're trying to use that circumferential movement of the hip, right? So we're trying to rotate in there. So we want to get some rotation through the hip. Pick that knee up about as, as high as you can, as high as you're comfortable with, and rotate it out. You don't want to go too herky-jerky and too fast, nice and controlled. You'll see what I mean in a second. And then we're just going to alternate. But again, work within the range of motion that works for you. Don't overdo. It shouldn't be injurious. It certainly shouldn't be painful. You should feel it. You know you're working it, but don't do it to the point of pain. Okay, so here we go. Alternating crescent steps. We're going to start with the right leg. So I like to do this in a fighter stance. My feeling is, if we're going to do this, let's do it. Let's make it, functional. Okay, just like if you were a fighter, instead of just, lollygagging and your hands hanging down here. So be up here, be on guard. Here we go. Right foot is the back foot. We're going to crescent out with the right. Switch my stance. Crescent out with the left. Switch stance. That's 2, right? Here we go. 3, 4, 5, 6, 7, 8, 9, 10. There you go. 10 and you're done. Okay? Next one is a knee strike. Again, like an MMA fighter. Here, martial artist, right? We're going to strike with the knee. Now remember, we're not just picking the knee up. We're striking. We're trying to hit something in front of us. An opponent, a target. If we were striking the bag, here, right? So you're picking the knee up, of course, but you're also sort of thrusting it forward, like a punch. Boom, right? So we're going to take that fighter stance, pick up that back knee, strike forward. Boom, there's 1. So if you look, there's a little bit of a hip, a little bit of extension here through the pelvis, right? Boom, here, right? So it's not just picking up, straight forward, okay? So here we go. Let's do 10, again, alternating. And here we go. 3, 2, 1. Strike with the right knee. Switch your stance. Strike with the left knee. Switch. Strike. 3, 4, 5, 6, 7, 8, 9, 10. Beautiful. That's standing. We're going to go right down to the floor. First thing we're going to do is go to all fours. So a quadruped position, hands and knees. And we're going to start with alternating bird dogs. You guys have seen this on some of the other videos. We're going to alternate extending the left arm and the right leg. Great way to work the glutes, get some hamstring work in there. Also great core stabilization, good balance challenge as well. So we're going to go right down onto the floor, all fours. And here we go. We're going to do, again, 10 total, but they're alternating, right? So here we go. So left arm, right leg. There's 1. Then right arm, left leg. That's 2. Okay? Just show you from the side so you can see. Left arm, right leg. 1. Actually, that's 3. Then the opposite pair. 4. 5. Hold it for just a second. 6. Try to get the balance work. 7. 8. 9. 10. Beautiful. There's 10. Next one we're going to do hip circles. Hip circles in the quadruped position. Okay, so on all fours. So we're going to do 10 one way, 10 the other. We're going to do the right leg, left leg. So we're going to go through this like basically four cycles. Here's how we do it, okay? First leg. Let's go right leg first. 10 circles, one direction, okay? So here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now we're going to change and go the opposite way. So outside circles, then an inside circle. 4, 5, 6, 7, 8, 9, 10. And remember, we're trying to get that circular movement in there to work that hip joint. Again, how far you move it is up to you and what your pain tolerance is and how you're feeling doing these, okay? So let's start again. Let's go outside. Now we're on the left leg, outside circles. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Reverse it. Now inside circles. 2, 3, 4, 5, 6, 7, 8, 9, 10. Beautiful. Done with that one. All right. Next one is the leg sweep. Leg sweep. I'm going to move to one side just so you can see me better. Okay. So again, from the all fours, we're going to extend the right leg. We're going to sweep it forward. Sweep it back. That's 1. Sweep it and back. That's 2. 3. 4. 5. 6. 7. 8. 9. 10. Nice. Slide over a little so you can see me. Let's do the opposite leg. So the left one, extend it behind you, drag it forward. And again, how far forward you go is really dependent on what shape that hip is in. Okay? 2, 3, 4, 5, 6, 7, 8, 9, 10. There you go. All right, next one I like to do, Spider-Man climbs. So not push-ups. You're going to stay in that high plank position. You're just going to step forward and you're going to step on the foot. We're going to do 10 alternating like we did with some of these other exercises. Okay? Spider-Man climbs, pretty simple. Here we go. We're up in high plank. Step forward with the right leg. 1, 2, 3. I like to sink into it just for a second. Right here, 4. That back leg, it's a great way to stretch out the hip flexor. The front leg gets a nice adductor work. 6. I think that's 7. I'm talking, I lose track of my number. 8. Is that senility setting in? I don't know. 9. 10. No, it's probably just stupidity. I can't count to 10. There you go. Okay. All right, let's go on to the next one, next activity. The next activity, I like from there to just go into half kneeling. Here, half kneeling, right? And now all we're going to do is rock. We're just going to rock. So from this position, we rock. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Excellent. From there, take that back leg. We're going to turn it 90 degrees. So these are perpendicular. My front heel points at my back shin. Stand half kneel, nice and tall. And now we're just going to rock again. I like to take the back foot and turn the toe out just a little bit. And we're just going to rock here. 1. You won't have as much motion on this one. That's okay. 3, 4, 5, 6, 7, 8, 9, 10. Beautiful. Switch your half kneeling the other way. Let's do the half kneeling rock, the first one. 1. If you notice the front leg when I lean back, I extend it all the way. I give my hamstring a little stretch on the back, on the front leg. 5, 6, 7, 8, 9, 10. Beautiful. Pivot the back leg 90 degrees. So we're in a perpendicular stance, nice and tall, rocking here. Turn that back foot. So basically, if you're looking at, if I'm around the other way, I'll just show you from here. I'm taking that back foot, and I'm, instead of my toe being here, I'm taking it here. I'm just turning it out a little bit. That's going to add a little more rotation into the hip joint. Okay, again, it's a rotator, so we want it to rotate. All right, so here we go. We're going to rock. 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Excellent. We're going to stay in the half kneeling position. If you got a kettlebell or a dumbbell handy, put it in front of you. That is just a handle. That's all we're going to do with it. Okay. We're going to half kneel here. Okay. Half kneel here. Right. What we're going to do is the front leg, we're going to do knee drivers. So all you're going to do is you can hold on to that kettlebell and we're just going to pick the knee up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. If you don't have something, a body bar, a kettlebell, a dumbbell, whatever, you can do this up against a wall or a rack, okay? Just something to stabilize with. And again, we're going to switch our stance and do 10 on the other side. Just drive the knee up. 4, 5, 6, 7, 8, 9, 10. Beautiful. All right, let's move on to our backs. A couple exercises on the back that I like to do. Okay, a couple exercises on the back. First one we're going to do, everybody knows it, is just a simple hip bridge. Next, I'll show you from the side because it's easier to see it. Here we go, hip bridge. We're just going to pulse out 10 hip bridges. So we're here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Beautiful. From here, we're going to just do prone leg sweep, or I'm sorry, supine leg sweeps. Okay, so the way it'll work, take your, let me show you a couple of different angles here. Take your right leg. We're going to turn your toe out here, and we're just going to do a big circle. Okay, we'll do 10. 7, 8, 9, 10, and then reverse it. So again, outside circles, inside circles, sort of like when we did the quadruped hip circles. And let's count again. Thinking about what's next. 10, good, all right? The next one is the other leg. Toe out. Again, we're going to go, I forgot which one I started with. So 10 one direction. 3, 4, 5, 6, 7, 8, 9, 10. Reverse it, 10 the other way. Here's 4, 5, 6, 7, 8, 9, 10. And remember, the range of motion you use is totally up to you. Keep it within the pain-free range, okay? It's not supposed to be super painful. If you've got hip arthritis or you've got chronic hip strain or maybe some ligamentous sprain in there, yeah, you're going to feel this, and you should feel it. It's supposed to be working, but you want to keep it in control, right? Don't overdo. The fact is, you're going to get better as time goes on. Do this 3 or 4 times a week and see how you're doing in 3 or 4 months. That's what it takes. That's what it takes. It takes time, it takes diligence, it takes commitment. So, if you string what we just did all together, boom, 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 you're done in about 10 minutes. If you want, and you just want to do a hip workout for your day, do that 3 or 4 rounds. I'll tell you what, you'll feel those muscles the next day, no doubt. If you want to just do it as part of your warm-up, getting ready for other workouts, then just go through it once. And you're done in 10 minutes, and you're pretty well warmed up for most things at that point, okay? So hopefully this information helps you guys out. I'd like to see you stay healthy. You know, we're all getting older. It happens. If you're lucky, it happens, okay? And we want to maintain our joints. It's good to be strong. It's good to be fit. But sometimes you also have to take some time just to do some healthy things for your joints, just to kind of counteract nature, okay? So here you go. Hopefully that helps you out. String it all together, 10 reps of everything, move right through it. Don't worry about spending tons and tons of time if you don't want to. If you're doing it 3-4 times a week, you're gonna get a lot of benefit out of it. So try that at home. Take a look at some of the other rehab videos I have on my YouTube site, okay? If you go to YouTube and just search for VFSV Joel Palmer, most of my videos should come up. You'll find my channel, okay? And keep at it, gang. We're going to try to throw some other stuff out at you later on to try to keep you healthy. So there you go. Enjoy your day. We'll talk to you next time.